Hi, my name is Akash Patel. I am a trauma and orthopedic consultant surgeon, and we will discuss really what is a hip replacement. So, a hip replacement essentially involves removing the ball and the socket of a hip joint. It's done because patients have lots of pain. That's the biggest indicator. We put in artificial implants, uh, which involve a new socket, a new liner, a stem, which goes into the thigh bone, and a new ball. These are made up of different components. The components include metals, ceramics, plastics, and we can have uncemented or we can have cemented version, and this is very dependent upon the patient. Now, the other question that I get frequently asked is, what are the indications for hip replacements? So the main indication for hip replacement is pain, and there are lots of different causes of pain in the hip joint. The commonest reason for patients having pain in the hip joint is arthritis or osteoarthritis. This is where the cartilage in the hip wears away, and that contributes to more and more wear and tear and pain and stiffness, and this can cause problems with walking. The other potential causes or indications for having hip replacements, as well as osteoarthritis, are things such as fractures. So sometimes patients, when they fall over, they break their hip. One of the treatments to get them walking again is a total hip replacement. Other things which are less common are things such as avascular necrosis of the hip. This means that the blood supply to the hip is compromised, and this is due to factors such as steroids, drugs. Other things that can contribute to this are alcohol, and this results in bone cell death, which causes wear and tear of the ball and socket, and then ultimately leads to lots of pain and reduction in mobility. So then the next step, or the next thing that patients ask me is really, when should I have a hip replacement? When is the best time to have a hip replacement? So there are two broad kind of categories really for this. So if it's an emergency, for example, if you've fallen over and if the fracture pattern or the type of break is indicative, then we may need to do a hip replacement as an urgent situation. The other more common time to think about having a hip replacement is with osteoarthritis. And this usually is an operation of choice. This means that when patients are ready, when their pain is bad enough, if they're limping, they've got pain at night, they're struggling with walking, they've got lots of stiffness, and they've tried the non-operative treatments, then we would consider a hip replacement. The questions are, what are the non-operative treatments, for example, with hip osteoarthritis? So we always emphasize the importance of things like physiotherapy, painkillers, weight management, lifestyle changes. So all basic things: eating properly, drinking properly, sleeping properly. And these are really important to consider before going forward with a hip replacement. Next question, patients always ask me this. So what does it involve? What is the process? What happens before, during, after the surgery? So usually when patients come in for any consultation, we take a history. That means we ask questions about their medical backgrounds. We examine their hips, then we undertake an x-ray. The x-ray gives us information about the degree of arthritis, so then we can plan for any potential surgery. Once the patient has agreed and they're keen to go forward with hip replacement surgery, then they have something called a pre-assessment. So the specialist anesthetic teams or the nurses will do a set of blood tests. They may organize something called an ECG, which is a heart tracing, to make sure that they're fit enough for an anesthetic. Then the patient will come in the morning. They'll either have a general anesthetic or something called a spinal anesthetic, and that's something that the anesthetic doctors will speak to the patients about. During the operation, which lasts a couple of hours, we make a cut around the side of the hip. We can do this operation in different manners. So there are different, what we say, approaches to the hip, but usually the incision is around the side. Then we remove the ball, remove the socket, we put in the brand new hip. Then after the surgery, the key fact is rehabilitation. So we want the patients to be up and about, moving and walking. After surgery, we undertake a blood test. We undertake a check x-ray to ensure the components are in a good position. We get the patients up and about walking, and usually patients stay in hospital for anything from 24 up to 48 hours, depending upon their recovery. It usually takes approximately 2 weeks for the scars to heal up, and then usually the first 6 to 12 weeks, patients have some soreness around the hip. Hip replacements can take up to a year for recovery, but usually it's much, much shorter. And the key thing is movement and physiotherapy. The other question patients ask, what are the risks and what are the benefits? So the benefits really are pain relief. That's the reason we do the operation. The risks with any operation and hip replacements include things like bleeding, infection, swelling, damage to the nerves, damage to blood vessels, anesthetic risk, blood clots in their lungs, in their legs. These risks are very small. Heart, lung problems, and specifically for hip replacements, things like dislocations, meaning the ball can move out of the socket, fractures, leg length discrepancy, and they can wear out, meaning that they have a finite lifespan. But this day and age, these risks are very small, in the region of 1% or so, and the components that we use are tried and tested and not experimental. That's why most people have, or most patients have, excellent outcomes with hip replacement surgery.